All right, welcome everyone. Thank you so much for being here. My name is Amanda McAllister-Wallner. I use she, her, hers pronouns, and I would like to welcome you to our workshop on self-advocacy tips to access gender-affirming care. To start us off, as we mentioned in the general session, we have a number of accessibility measures in place today, including ASL interpretation, as well as Spanish language translation, which you can access by clicking on the interpretation globe at the bottom of your screen, if you would like to watch the presentation in Spanish. And if you have any questions at all, please feel free to put those questions in the chat throughout the day today. We are asking, when you are not asking a question, to please keep your video off for the ease of spotlighting our ASL interpreters. And I think that is it for announcements, and I will go ahead and pass it back over to our presenters today.
Thank you so much for inviting us, Amanda. And hi, everyone. My name is Jackie Dye. I will be co-presenting with a number of different panelists on self-advocacy tips to access gender-affirming care. My pronouns are she and her. I'm a supervising attorney with Neighborhood Legal Services of LA County. Neighborhood Legal Services of LA County serves people that are low income that live in the LA County area. In addition to healthcare, we also specialize in housing, including eviction defense, affordable housing, public benefits, support for domestic violence victims, worker and consumer rights, and employment and training. And I will pass it to Skyler.
Hi there, my name is Skyler Rosellini. My pronouns are he, him, his, and I'm a senior attorney with the National Health Law Program in Los Angeles. And we're a national healthcare organization that's focused on breaking down barriers to healthcare for low-income individuals and communities. We focus mostly on Medicaid and the Affordable Care Act as it sort of relates to that mission. So I'll pass it on to Antonio.
Good afternoon, everyone. Antonio Page-Kahn, he, him, staff attorney with Legal Aid Society of San Diego on their health team. I'm happy to be here and look forward to the presentation. And I will pass it to Dina.
Good afternoon, everyone. I'm Dina Dimirjian. Pronouns are she, her, hers, and I am a staff attorney at Neighborhood Legal Services of Los Angeles County.
So our agenda is, we have a robust agenda today. We're going to cover who we are, common issues that impact LGBTQIA community, common issues impacting gender-affirming care access, gender-affirming care overview and policy developments, how to access gender-affirming care as a consumer, how to overcome barriers to gender-affirming care, and provide some resources and contact information at the end of our training. So who are we? We are all part of the Health Consumer Alliance. The Health Consumer Alliance is the official consumer assistance program that's supported by a state agency called the California Department of Managed Healthcare and Cover California. The HCA also partners with the Department of Healthcare Services to serve as the Cal MediConnect Ombudsman and California Coverage and Health Initiatives to support Medi-Cal enrollment activities of partner application assisters and community-based organizations. These agencies and others will refer consumers to our HCA partners who provide legal services in each of California's 58 counties, one of which is Neighborhood Legal Services of LA County, which Dina and I are a part of, and Antonio is part of Legal Aid Society of San Diego. Next slide, please. There are a number of direct services partners that are part of the Health Consumer Alliance. They're listed all on the left-hand side, including the two that we have 3 representatives from. On the right-hand side, there are support centers that the HCA works with, including Justice and Aging, National Health Law Program, which Skyler is a part of, and Western Center on Law and Poverty. If people would like to access more information about HCA and tons of resources, they can access those on healthconsumer.org or call that 188 number. Next slide, please. So some common issues that are impacting LGBTQI community. If you can also feel free to add any additional issues into the chat. We'd like you to add it as well if there's any issues that we might have missed here. One of the top issues that we do see is cultural competency of different types of medical providers. That can include the primary care physician, finding a primary care physician, specialty care, mental health providers, dental providers, and optometrists, accessing both PrEP and PEP medication, monkeypox vaccine access. This has been in the news of late, and medication access as well. Health insurance coverage for both vaccine access and medication access, along with Medi-Cal coverage. Next slide, please. What are some of the issues that you or others have faced in accessing gender affirming care? If you'd like to add into the chat or add any questions, please feel free to do so. What we commonly hear the most at the Health Consumer Center at Neighborhood Legal Services includes hair removal, both laser and electrolysis, transition-related surgery. That's both pre-surgery requirements if they need medical clearance, including tuberculosis clearance, a supporting letter from a mental health provider, and or post-surgery aftercare. Gender markers on medical cards, including Medi-Cal benefits or health insurance identification cards, sexual orientation, gender identity, hormone therapy. Some people might need access to injections versus a medication. Sometimes that is really difficult to obtain through different healthcare delivery systems. Health insurance coverage of medically necessary services, and that's both through Medi-Cal and private insurance. Next slide, please. Going out of network to access specialty providers. This is a top issue that we commonly see at the Health Consumer Center. It's very difficult to find specialty providers in more rural parts of LA County. I would imagine it's the same statewide or other parts of the United States. And so oftentimes people reach out to the Health Consumer Center to help navigate in terms of accessing a particular surgeon and or specialty provider. Some areas that you can obtain additional support and access to resources include support groups such as the LGBT Center of LA. They have a trans lounge support group, aftercare support, both physical support, meal preparation, bathing, cleaning, wound care, and ensuring places are not infected. Transportation, non-emergency medical transportation is an available benefit through Medi-Cal, and non-medical transportation for fee-for-service Medi-Cal beneficiaries. Access to mental health providers and gender dysphoria diagnosis. I see here in the chat, Ian Anderson also adds blanket bans on gender affirming surgeries for people with self-insured plans, limits on availability of care for trans minors, lack of experienced providers in the network, hence going out of network to access specialty providers and specialty care. So I think it's there is a lot to be done, and I would engage this group to continue and in terms of your self-advocacy and also community advocacy. Okay, and I will pass it to Skyler, who will be covering the overview and policy developments.
Hi, everybody. So I'm going to focus on just sort of the kind of bare bones of accessing gender-affirming care and policy developments in California, and also on the federal level that impacts California as well. I won't spend too much on my slides because I want to make sure my colleagues are able to go over really the meat of this training, which is accessing gender-affirming care and kind of working through things like the appeals process. So first, just like Jackie went over, these are just some very broad strokes buckets of gender-affirming care services that folks, need and want to access. Certainly not an exhaustive list here. Things like mental and behavioral health, peer support, hormone therapy, surgery, voice therapy or modification, body contouring, things like that. It's such a vast list of gender-affirming care. So the general criteria when trying to obtain gender-affirming services, the things that have to be demonstrated when you're going through your insurance is one, as Jackie sort of touched on, is that there has to be a documented diagnosis of gender dysphoria. That's the diagnosis code that insurance companies look for when they are covering a gender-affirming care service. The second main piece of criteria is that the patient has to give informed consent, and that's not really unique to a lot of surgical services, especially. Patients have to give informed consent, know that they can make a fully informed decision and consent to treatment. The third requirement is that any relevant health concerns are reasonably well controlled. So there's no other health conditions that are, that would be, harmful or would inhibit the ability to provide certain gender-affirming service. And then the fourth is a documentation of medical necessity and or reconstructive, it's a reconstructive procedure. And we'll dive more into what those two things mean. But medical necessity, again, this is not really unique to gender-affirming care. This is a requirement when you obtain really any type of medical service that is covered by your insurance plan. It has to be medically necessary. And then it has to be a reconstructive procedure. It's another standard, at least with Medi-Cal plans. Like I said, we'll get into that. That could be another avenue to have insurance cover it. And then it has to be based on nationally recognized medical clinical guidelines. And of course, this is a bit controversial and in flux because trans healthcare has really changed a lot over the years, and we're learning a lot more. There's a lot more investments in the medical field to really know more about trans health. But if you look at Medi-Cal's policies, on the criteria for covering gender-affirming care, really most state-based insurance policies that cover gender-affirming care, you're going to see a reference to the WPATH standards of care. That's the World Professional Association for Transgender Health, and it's not necessarily required that policies have to follow the exact criteria in the WPATH. It's really meant as a guideline. It's supposed to really inform policies to accessing gender-affirming care. The 7th version came out a while ago. I want to say, it was either maybe 2011 or 2016. I may have that wrong, but it's old. It's very old. It's outdated. If you've looked at it, there's a lot that's changed since this was released. And you may have seen that the 8th version was released for comment, for public comment. So the WPATH is developing that 8th version that I think a lot of us are waiting for, and hoping that there will be a lot more updated guidelines that are just more in tune with where we are at with trans health care. And then last, it has to be opined by specialist experience in providing care to transgender individuals. This comes up a lot when you see a denial to healthcare, and something that, you know, I can tell you, I'm sure all of our advocates have seen, is that oftentimes medical examiners, providers who are doing independent medical reviews aren't necessarily experienced in providing care for trans and gender diverse folks. But they're issuing these decisions that have a huge impact on the lives of trans and gender diverse individuals. And so there are legal requirements that those decisions really need to be issued by someone who's actually experienced in this care, which is really important. Just to sort of unpack that medical necessity and reconstructive surgery standard, I put the language here, and I cited here the guidance from the Department of Healthcare Services for, this is specific to Medi-Cal plans. But you'll see a lot of these standards are pretty transferable to other state-based insurance. So for medical necessity, what does that actually mean when we say medically necessary? The language, the legal language is that it's reasonable and necessary, that the service is reasonable and necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain through the diagnosis and treatment of disease, illness, or injury. So, I mean, that's, you know, pretty broad language to really justify access to gender affirming care services. That's the main standard. Now, with Medi-Cal plans, there's an language you'll see in this all plan letter that I cited, 20-018, that it can also be based on whether the service is reconstructive. And that's performed to correct or repair abnormal structures of the body to create a normal appearance to the extent possible. And of course, language is kind of problematic. What is normal, really? When we talk about you know, any kind of care, but you know, in the context of gender affirming care, you know, normal appearance is determined by the gender which the beneficiary identifies with. And I think that's pretty strong language to really, again, fight barriers and really defend access for all trans and gender diverse individuals. That it's not looking at a certain way to, you know, fit in a neat box of what a gender looks like. It's really what does that mean to the patient? And so these services, these decisions on covering these services need to be done on a case-by-case basis. They need to be done based on that patient, not based on what a man looks like or a woman looks like, or, you know, it can't be based on those types of standards. That's illegal. And it needs to be determined by a qualified, licensed mental health professional. That's the mental health letters that Jackie was referencing earlier, and the treating surgeon in collaboration with their primary care provider. Now, you know, just want to note that, you know, for those gender folks who are accessing gender affirming services, they don't need to get a mental health letter to do that. But that is unfortunately a requirement today for accessing gender affirming services, and maybe someday that will change.
Salud mental.
So I won't spend too
Entonces,
much. Oh, I'm sorry. Does somebody have a question?
disculpen, ¿alguien tiene una pregunta?
I think someone's off mute.
Creo que
maybe
alguien está en
the interpreter.
silencio.
I think one of the interpreters is off mute. Thank you. All right. Thank you. Sorry about that. So this is just the, again, broad bare bones analysis of medical necessity. I won't spend too much time on it, but really it's, you know, is there documentation of gender dysphoria? And, you know, is this surgery needed to protect life, to, you know, address a dangerous condition, as, you know, the medical necessity language that I went over states. that's really enough to justify medical necessity. Of course, there's this language, and you'll see here in the second bullet, some denials for care, some denial letters. You'll see, oh, well, this is denied because there's less restrictive or less invasive treatments to alleviate these symptoms of gender dysphoria. And I would say if that language goes up and it's been deemed medically necessary, if the provider who's submitting the authorization supports the service and thinks it's medically necessary, I would definitely fight that kind of language. But if all else fails with the medical necessity analysis, you can definitely go to the reconstructive surgery standard as well. So don't forget that standard. There we go. Sorry about that. So system-related federal and California policies. Again, this painting is a little leaning on Medi-Cal, but we are going to go over other sources of insurance. Now, with federal protections and policies, obviously there's the Affordable Care Act, which has really changed access to gender-affirming care services. For one, there's this Section 5057, which is the non-discrimination provision in the ACA. There's been a lot of drama with that, which I'm going to go over in our next slide. But it was really big because in 2016, when the Obama administration released the final rule, they interpreted discrimination based on sex to include gender identity and sex stereotypes. So again, that was really important because it, again, really opened up the ability to access gender-affirming care services, or to at least fight barriers and denials to gender-affirming care services. Second, there's Health and Human Services, Office of Civil Rights. You can submit complaints through OCR when there are improper barriers to gender-affirming care services. Our current administration is taking that very seriously. The administration before was not, but we've seen guidance come out from the Biden administration that really encourages folks to utilize the OCR complaint process to address barriers to care. And then there's HIPAA, which some of you folks might be very familiar with, which really protects patients' privacy over their medical information. It also is meant to ensure that individuals can access their medical information as well. And this is important because, as you've, I'm sure, seen, there's a lot of attacks on gender-affirming care access throughout the country right now. A lot of legislation being introduced that's trying to criminalize access. And, HIPAA is important, and HHS, Health and Human Services, has, again, issued guidance really reminding insurance companies, providers, covered entities that, you might have a state law that's trying to ban this, and you still need to follow HIPAA. You still need to protect your patient's privacy. And then there's also Medicare, another main federal health insurance program. Medicare does cover gender-affirming care services. However, the guidance, again, has been through a lot. And right now, there's no national coverage determination from Medicare that says outright that gender-affirming surgeries are covered. There's nothing explicit about that, but they also aren't saying that it's not covered. So it's very strange language. If you look at that National Coverage Determination Letter 140.3, it has a lot of really outdated, quite kind of offensive language in there. It's very old, and that's definitely an area where we hope to see more advocacy and improvements with accessing gender-affirming care, especially because that largely impacts trans and gender diverse individuals who are older and or who have disabilities. And so that's really bringing up a barrier for those communities. However, people do get access to gender affirming hormone therapy and mental health services through their Medicare. And people do access surgeries that way too. It just often involves a lot of fighting with Medicare, unfortunately. Last with TRICARE, we definitely get a lot of questions with that, with veterans who are trying to access gender affirming care services. Unfortunately, TRICARE is very limited on their policy right now. They do cover gender affirming hormone therapy, counseling for gender dysphoria, for active service or active duty service members. They do cover surgery. However, for veterans, they do not. What's interesting with veterans, though, is that they do provide coverage or provide care for pre-op assessments, for gender affirming surgery, and they also cover post-op care and long-term care following surgery. So kind of interesting how that works. But hopefully, again, this is an area that we hope to see change to expand access for trans and gender diverse individuals. And then second, with California, we have our Insurance Gender Non-Discrimination Act. That's our state's Non-Discrimination Healthcare Act that says you can't, you have to provide equal access to health services. You can't discriminate based on sex, which includes gender identity, gender presentation, sexual orientation. So it's a very strong law in the state of California. And you'll see with the Department of Managed Healthcare, which regulates state managed care plans, they've issued their guidance, which we've listed on the slide, reiterating this provision. And then the Department of Healthcare Services, which administers our Medi-Cal program, has also issued guidance reiterating the IGNA provision, same with the California Department of Insurance. All right, so some developments here. At the federal level, I mentioned Section 1557. Again, you might be familiar that they released a notice of proposed rulemaking. And so a new rule, because the Trump administration had essentially gutted it, removed the interpretation for sex discrimination. And this new proposed rule brings a lot of the language in the 2016 rule back and improves on it. So it prohibits sex discrimination in health programs, insurance coverage, services related to marital status, parental family status. It defines sex as sex stereotypes, sex characteristics, including intersex traits, pregnancy or related conditions, sexual orientation, and gender identity. The National Health Law Program is, we set up a landing page on Section 1557 if you want to learn more about it. And we're also really encouraging people to make their voices heard, share their stories and their experiences for accessing gender affirming care. And we set up a comment portal, which I've linked on this slide so that you can submit your comments. I want to make sure I'm moving on here for my colleagues, but just some other developments that have happened on the federal level. The Biden administration has released several executive orders to address discrimination with access to healthcare, inclusive learning in schools, including SOGI data collection, trying to standardize and improve that, and a number of other things for LGBTQI folks. And in California, some developments that have come up is, so we've been working with the state and trying to improve the Medicaid application or Medi-Cal application, which has a required gender question that isn't inclusive. And I know a lot of advocates here have been working with DHS to try to improve this, but they have submitted a proposed single streamline application for Medi-Cal to CMS for approval. They did that in March 2022 to have a gender question that has more inclusive options, especially considering the Gender Recognition Act, which also recognizes non-binary gender identity, and then to also include SOGI questions, which are voluntary, but again, through California laws, are required, DHCS is required to be collecting this data to try to address health disparities amongst LGBTQI+ population. And so they've released interim guidance in the meantime, while that application is under CMS review, to ensure that any individual, transgender, non-binary, or another gender identity who's applying for Medi-Cal doesn't fall through the cracks because of the questions that they ask and how that might interact with verification systems and things like that. And then we, of course, have been working with them on SOGI data collection, really trying to ensure that that is moving forward and that they're actually implementing it, because as of 2018, they were supposed to be collecting it, and it's 2022. So that's a big issue that myself and my colleagues have been working on, and then also improvements to managed care for Medi-Cal. So I'm really pushing the state to make accessing gender-affirming care services more accessible, really educating beneficiaries that these are available and you can access them and here is how, and really trying to educate health plans on the care that they need to provide. And so in all, what this means really is that it's hard to legally justify denying gender-affirming care in California. It's easy for health plans to do it. They do it all the time. But through the appeals process, it's hard to really legally justify it. If it's medically necessary and fits the criteria, it should be covered. There should be no categorical exclusions, no saying that certain services just aren't covered at all. That's illegal. Must be evaluated on a case-by-case basis based on the individual. And independent medical reviews, like I said earlier, have to be evaluated by a provider who's specialized in providing care to transgender and gender expansive individuals. And if services are covered for a cisgender patient, they should be covered for a transgender patient too. So those are the main takeaways, and I'm going to pass it on to my colleagues for access.
Thank you so much, Skyler. So now we're going to talk about a little bit more accessing gender-affirming care. How do we actually do that? Next slide, please. Skyler, next slide. Thank you. So on the outset, we need to figure out who regulates the plan. It's important to know the key players involved in the regulation of a plan so that when you're seeking healthcare and gender-affirming care, you know where you fit in. Some plans are regulated on the federal level, whereas others are going to be regulated on the state level. On the federal level, we have certain employer-based plans. These are plans that look to ERISA, the Employee Retirement Income Security Act of 1974. Antonio mentioned in the chat that this is from 1974, so there might be some outdated things. Of course, it gets updated. ERISA is the U.S. labor and tax law that governs employer-sponsored health insurance in addition to retirement. Generally, the plans that fit under here are self-insured plans, sometimes called, and sometimes they're employer-created, and they're administered by an insurance company, although they can also be administered to the employers themselves. On the state level, we have Medi-Cal plans, covered California plans, and smaller employer-based plans. The Department of Healthcare Services, DHCS, oversees both Medi-Cal fee-for-service and Medi-Cal managed care plans. The Department of Managed Healthcare regulates Medi-Cal managed care plans, covered California plans, commercial HMOs, Blue Cross of California PPO, Blue Shield PPO, and some other managed care plans as well. And California Department of Insurance The CDI goes and oversees and regulates all other PPOs. Next slide, please. So the Department of Healthcare Services. Medi-Cal recipients, whether they're in fee-for-service Medi-Cal or managed care plan, can appeal their denials for any gender-affirming care by requesting a Medi-Cal fair hearing, also known as state fair hearings. Medi-Cal recipients can request a fair hearing by phone, mail, or online, and this information on how they can appeal can be found on both the back of their notice of action or online, and we've provided the link there. Administrative law judges hear and decide these cases, but you do not need attorney representation. It is much more informal than other types of hearings, as it's just an administrative hearing. You can represent yourself or you can employ an attorney. One tip we have here is if you are in a Medi-Cal managed care plan, if you want to appeal the denial, you should consider filing first with the Department of Managed Healthcare, DMHC, as you can go through that path first and then appeal with State Fair Hearings Division. But if you do a State Fair Hearings first, you cannot then go to the DMHC. Next slide, please. As for the Department of Managed Healthcare, those who are regulated under this program can file a complaint or an independent medical review, also called an IMR. Generally, a consumer needs to file a grievance and appeal with their health plan first, receive a response, and then proceed with DMHC. Once the health plan denies whatever they're requesting, the consumer can then go to the DMHC either online, by fax, or by mail and complain. The DMHC will take around 30 days to respond to a complaint and around 45 days to respond to an independent medical review, as that has to go through physicians who are then reviewing the case. In some cases, DMHC will provide an expedited review for an urgent case. The DMHC defines urgent health problems as one with a serious and immediate threat to your health. If the case is expedited, health plans have 3 days to respond to a complaint, and IMRs should generally be resolved within 7 days. And a tip here is how to get that expedited review. All complaints and IMRs are screened for expedited review, but it is very helpful in the initial part of your complaint to either write in expedited review requested or urgent review requested, and add a couple of sentences regarding why it is urgent. What is the threat? What is the harm that will be done? And I will now pass it on to Antonio to provide a more in-depth and step-by-step way of overcoming barriers.
Good afternoon, everyone. Again, Antonio, he, him, his. I know we're kind of talking through steps by steps, and it can get really confusing about the different approaches to this, what type of Medi-Cal plan you have and where to start. So hopefully this is a helpful guide to get you started. But if you want help, definitely contact one of us, the Health Consumer Alliance. We have coverage all throughout the state of California. One of our firms tackles a different geographical area, so we can definitely help you, and our services are free. So if you need assistance with that, definitely contact us. But here's also a little guide to get you going. There's about 5 steps if we're doing this from a Medi-Cal health plan process to look at. The first one I think is important for no matter everyone's plan. Gather important documents and take notes. I can't tell you how many times how taking notes have saved my cases. I will call health plans and they'll say stuff never happened. You never filed a grievance. You never appealed. You never called, even though you'll have the letter of acknowledgement from them with the file number, the appeal number, and they will still deny stuff doesn't exist. So taking notes, it's going to save you so many times down the road, I can't even explain. Let's just kind of get started. Next slide, please. And if I cough, I apologize. I'm struggling with COVID. So if I disappear for a second, I'm just getting it out of my system. Next slide. Okay. So some important documents for no matter what health plan you have. Evidence of coverage is going to be probably your first and most important thing. This is generally a description of what benefits are covered under your health plan. Most of the time, it's called evidence of coverage. Sometimes they'll call it the member handbook. Sometimes they'll call it the benefits handbook, but almost always evidence of coverage. If they're saying explanation of benefits or summary of benefits, that's generally a completely different thing. That's usually after you've requested a specific service or prior authorization. They'll send you a response that's very specific to that service. So if I'm, let's say, requesting lab work for prep related services, right? And they're going to send me a back say, oh, you aren't covered for the name brand Truvada, but you're covered for this brand because of this benefit. And that's usually the explanation of benefits that is sent to you. Now, all of these are usually received in written notices from your health plan. You can request for them to be emailed and stuff like that. When you do that, these are extremely important. These notices, especially if you're on Medi-Cal or Medicare, these are huge deals for you to keep. The dates when you receive them can be really important. The language of them can be really important. I've pushed a lot of my cases on improper notices, improper language. So keep these when you're doing them and kind of file them as you're going along. They can be labeled stuff like notice of action, notice of adverse benefit determination, a denial, an appeal, grievance, an acknowledgement letter. They have a lot of different labels, but if the insurance has sent it to you, even though they spam you with 100 other pages that can seem like they're repetitive, the emails are still really important as well as the letters. Other important things when we're accessing gender affirming services are going to be your support letters from your primary care physician, as well as your mental health support letters. How many mental health support letters you need depends on the service, unfortunately. I know it's gatekeeping, but if you think of it as more of a checklist of things you need, it can kind of help the process along a little bit. Next slide. Okay, taking notes. Again, this is so important, I'm gonna come back to it. Taking notes is extremely important. I have had too many cases where I've called and I filed grievances and they pretend that the grievances don't exist, the appeals don't exist, the phone calls don't exist. They will act like amnesia has hit all of a sudden and everything that was beneficial to you is now gone. Even if you have written correspondence from them confirming it, they will pretend like it doesn't exist. So when you call, write down the date, the time, the phone number you called, the department you're talking to, and the person you're talking to. If you file a grievance or an appeal, they'll almost always give you a confirmation number. Write it down, because if you have to go later and file a state fair hearing or file a DMHC complaint, you're gonna put that up right there for them to see. I have all of this information of what I did, and they're not doing what they're supposed to be doing. Next slide, please. Okay, second, once you kind of gathered all the important information and documents, you're going to figure out, okay, what's the regulating authority? As we've kind of talked previously, it's either federal law or state law. Now, if it's state law, federal law, if it's federal law, state law doesn't apply because of preemptive rules. If you're kind of a legal nerd and you want to get more into that, reach out to us and we can really dig into that. But for the general purposes, if the federal law applies for ERISA, then generally the state law is not going to apply. As we said earlier, ERISA was passed in 1974. It doesn't even have language saying non-discrimination on the basis of sex. That's how old it is. So when you think of it, state law is much more protective. If you have a state regulated plan, you have protection for gender affirming services. The same really can't be said in practice for federally regulated plans because of so many more hoops you have to jump through, different complaints you have to file. It's much more tough, I'm going to be honest with you. For employer-based plans, if you're trying to figure it out, you can always go to your human resources department and ask them, are we ERISA regulated or DMHC regulated? If you go back to our other slides, when you have a chance, and it labels as self-insured, and that's essentially saying, okay, is my employer, are they the bank for these insurance claims? Or are they contracting this service out to a different agency, right? And those are kind of what you're interested in and to determine if it's state or federal. If you're a covered California plan, you're state regulated. If you're Medi-Cal, you're state regulated. Medicare, federally regulated. So that's the first step to figure out. And next slide, please. the steps that I'm going to kind of proceed through next is if you're a state regulated plan, particularly Medi-Cal. The next step you're going to do is you're going to file a grievance or an appeal with your health plan for each violation or barrier. And what I mean by this is barriers to accessing gender affirming care, they rise their ugly head in many, many different forms, whether it's a lack of in-network competent providers, an inability to figure out who your in-network providers are, barriers or denials, improper and inappropriate denials. So anytime something happens, you need to feel kind of like a Karen, call your health plan and file an official grievance, because what happens is the health plan will then go to the state when they're being regulated and they say, oh, look, we're perfect. We have no grievances. No one's filed a grievance on our gender affirming services. We must be amazing. And unfortunately, if there's not a paper trail in the legal world, it kind of doesn't exist when they're being audited, unfortunately. So I have a lot of people calling me about certain health plans and say, they're a nightmare, they're terrible. But because people aren't filing official grievances with the health plans and taking complaints, on paper, it looks like they're perfect and it's really hard to fight. So some of the violations you can do. If your grievance wasn't adequately considered, and what does that mean? I called for a case one time and I said, hey, we do now, but we didn't have any bottom surgeons here in San Diego County. So I know you have no in-network providers. Please refer us to an out-of-network provider who can provide these services. Well, when they responded to the grievance, they said, oh, we have adequate in-network providers, period. And they didn't say, oh, who is it? How do I contact them? How do I get the referral going? All of that information. And we knew they couldn't provide that information because there's nobody in San Diego County at the time. Right to a written notice. This is important. When you file a grievance, when you're Medi-Cal, you have a right to a written response, right? Them calling you over the phone and telling you something is not sufficient. It needs to be in writing and it needs to be clear and concise. If they're calling you and they're telling you, oh, we don't think this is medically necessary, they need to tell you why, and not just, we don't think you're medically necessary. And they need to do so in writing. You have a right to a second opinion. They can't force you to go to only one in-network provider because that's all they have. They still have to provide it out of network. And then also right to a medical necessity review. Skyler had gone over the medical necessity analysis, and I've had health plans screw it up all the time, right? I've had a provider or a health plan request a client to grow a facial beard to show that facial hair to show that they needed laser hair removal before facial feminization surgery to determine it was medically necessary. That is not appropriate. If you're relying on images, pictures, stuff like that on determining medical necessity, not appropriate. File a grievance, file an appeal, file a discrimination complaint. Next slide, please. Some other ones. You have a right to a list of in-network providers. I have yet to be able to call a Medi-Cal plan in San Diego County and ask for a list of in-network providers and receive it, ever. In my 2.5, almost 3 years of doing this work, I still haven't been able to do it. And my caseload is all gender affirming care cases. So file a grievance for it. Right of out-of-network services. For Medi-Cal, if they can't provide it in network because they had no bottom surgeons here in San Diego County, they were required to pay for my client to go out of network, which meant in LA or San Francisco, receive those services, pay the provider for those services, as well as all travel related expenses. So lodging, food, a caregiver, transportation up there, all of it. Next slide, please. Right to an out-of-network provider. One note I want to make on this, you have a right to an out-of-network provider, but that's not any provider of your choosing, right? They still have to accept the Medi-Cal rate. There are still some other conditions to it, but they still have to provide those services to you by some provider. Next slide, please. Okay, you filed the grievance and the appeal in the previous slide and it came back and it's still wrong, right? They're still saying, oh, we have surgeons, the bottom surgeons here in San Diego County, when we know they're lying. Your next step is to file a DMHC complaint. Now, when can you file a DMHC complaint or an IMR, an independent medical review? And that's within 30 days. If the plan fails to resolve your issue within 30 days, that's your hard stop deadline where you can file a complaint or an IMR. Or whenever they respond to your grievance or appeal. So let's say I call on August 1st, right? Call on August 1st the health plan. I file a grievance. And on the 15th, they send me a response and say, nope, still not medically necessary to go out of network because we have in-network surgeons. Okay, well then, right then and there, I can file a DMHC complaint. I don't have to wait the 30 days. Now, the difference between a complaint and a independent medical review. Anytime it involves the question of medical necessity, it is an independent medical review that you'll be filing because they will be sending it off to an independent medical reviewer. That's not your surgeon, that's not your health plan, that's completely different to do an analysis and then make a medical necessity determination. But for complaints, it's everything else. So what I do and my approach is when I'm filing a complaint, I include everything I would need also for an independent medical review. So I include my mental health support letters. I include my primary care physician letter. I include, whatever other things that are needed within it to also satisfy that medical necessity, so that if the health plan changes their strategy, because they will do that, they will flip on a dime, they'll lie 1 second out their face and talk the other. So I don't trust anything. So I prepare for everything and I file it with a complaint, because a lot of the times I actually only need a complaint. Right? If it's, oh, we denied you because we have in-network bottom surgeons here in San Diego County. Well, I know that wasn't true, but I knew the health plan was going to try anything last minute in order to change the procedure or the services received. And it happened. We went to the complaint, prepared everything for IMR. And even though my client had started paying out of pocket for consultations, they still wanted my client to start all over with a brand new surgeon that they had already denied. So when I'm telling you anything can happen, don't trust insurance companies, let's take notes. Next slide, please. Oh, one last thing on the last slide, but you don't have to change it back. Make sure you're filing a grievance for every single thing that they've done wrong, because when you go to the DMHC complaint process, you're going to highlight that and say, look at all of these barriers. It's not just one thing. It's been repetitive. I've tried 6 months and they've done nothing. Because when you then are trying to ask for a specific provider, you can say, look, I tried their way and it didn't work. They need to now get on board with what I am already pursuing in these services and stuff, and it works. Step 5. So let's say you've gone to a DMHC complaint and they came back and they sided with a health plan. You still have the option of going to a state fair hearing. You can't do the other way. You can't do a state fair hearing and then a DMHC complaint. It doesn't work like that. So please, 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 I mean, first call us so we can help you. We can strategize, even if you want to do it independently, but most certainly go to DMHC before state fair hearings. DMHC complaints have a really high success rate. You can even look online. During COVID, there's extended times too. So during the public health emergency, there's 210 days you have to request the state fair hearing. Next slide, please. Oh, and then I'm going to pass it to Dina. And if you have any questions, you can email me as well. Thank you.
All right. So now we have a hypo for you all, and your answer is already there, but we have a scenario here. A consumer identifies as female. They use she, her pronouns, and they're in a Medi-Cal managed care plan. Her health plan denied electrolysis hair removal and request, and the plan considered it cosmetic and not medically necessary, and that's the reason for the denial. She filed the grievance with her plan. They upheld the decision as not medically necessary, despite her diagnosis of gender dysphoria. So what's the next step? And it is to file with the DMHC. Next slide, please. So this hypo is actually one of our DMHC success stories. As Antonio mentioned, we get a lot of success when we're filing with the DMHC for gender affirming care. In this case, our offices helped this consumer file the DMHC complaint, and we explained the need for the hair removal due to the diagnosis of gender dysphoria, pointed to the health plan's own policy, which was contradictory to their denial. So again, when Antonio mentions making sure you take notes, making sure you're looking at those documents from his step 1, that is what we're talking about. In the initial denial, there was reference that the plan made about a clinical guideline, and it was completely against what they were deciding on. So when we filed the complaint, we did have to change it to an IMR request for laser hair removal. Some things that you encounter are little technicalities, because electrolysis is considered cosmetic. So the DMHC reached out to us, told us to file again as laser hair removal, and that if and when that was granted, they can then switch it back to electrolysis, which is more cost efficient for health plans, but they need that first decision that they are granted that hair removal. So once we changed that complaint to an IMR and that request was also denied, DMHC took it under IMR. They overturned the health plan's decision to deny the laser hair removal. Again, there were some issues after DMHC overturned that decision. The consumer wasn't able to get an appointment because the approval wasn't posted with the plan. But after contacting the DMHC again, the consumer was finally able to schedule that needed gender affirming care, and we were very happy with that result. Next slide, please. And I'll pass it back to Jackie.
Thank you, Dina, for that. So we have a new Stop the Hate program at Neighborhood Legal Services of LA County. One of our members is actually on this, joined this presentation today. Her name is Catherine Amadi. But it is a program that is working with survivors of both hate incidents and crimes. And it's a new one that just got funded through the California Department of Social Services to provide support and services to victims and survivors of hate incidents and crimes and their families, and to facilitate both hate incident or crime prevention measures. So just a few definitions briefly. Hate incident is an action or behavior motivated by hate, but which for one or more reasons is not a crime. Hate crime is against a person, group, or property motivated by that person's victim's real or perceived protected social group. You may be a victim of a hate crime if you have been targeted because of your actual or perceived disability, gender, national or racial identity, ethnicity, religion, sexual orientation, or association with a person or group with one or more of these actual or perceived characteristics. So please join us in working towards stopping the hate. Next slide, please. If you are a victim of hate violence, you can file a complaint with the Department of Fair Employment and Housing, and that's now the California Civil Rights Agency. Report the incident to other places, including in LA County. They have an LA versus Hate program, District Attorney's Office, or the California Attorney General's Office. You also have a right to file a private lawsuit under California Civil Code Section 52 to enforce either the Ralph or Bain Civil Rights Acts. Next slide. So the California Civil Rights Department, formerly known as DFEH, requires filing within 1 year from the date that the victim becomes aware of perpetrator's identity, but no more than 3 years from date of harm. There's no need for an attorney or for payment of any filing fees. You can report the incident to the police. If you're a person with a disability, you can call and they can help you fill out the intake by phone or through California Relay Service. So there's links in the PowerPoint to filing the complaint through the California Civil Rights Department. But if you reach out to Catherine or myself, we can also guide you in terms of helping you file, but you have to be a resident of LA County. I know that this is a statewide convening. Next slide, please. So we have some additional resources available that we wanted to share with the audience. For Stop the Hate resources, there's a phone number that you can call, or you can email that stopthehate@nlsla.org online, NLSLA online intake. If Catherine, if you can add your direct line and also our other staff that member who's working on this Stop the Hate grant. Her name is Helen Ding Vu. I will also add her direct line into the chat. Oh, and Catherine, I see, has already put her email in there. Thank you. Finally, but last but not least, I believe Amanda shared this in the chat earlier, but there is a wealth of resources and materials available on our Health Consumer Alliance website, and that's at www.healthconsumer.org. Next slide. There's additional crisis resources available at the Trans Lifeline, the Trevor Project, LGBT National Hotline, National Suicide Prevention Lifeline, 988, the new 988 number, National Coalition of Anti-Violence Programs, National Youth Talk Line, and a LGBTQ helpline for South Asians. Additional trans-specific health resources are available at the following links, and Help's Advocates Guide to Medical Services, which I know Skyler co-authored among other people, Transgender Legal Defense and Education Fund Trans Health Project, the Trans Health Consulting website, National Center for Transgender Equality, and Transgender Law Center, which Ian Anderson is a part of. And if we have any questions, we have a few minutes left for Q&A. Please feel free to add your questions to the chat or raise your hand.
Just going to chime in really quick. I have up our contact information. As my colleagues have said throughout the presentation, always feel free to reach out. We're very passionate about this area of healthcare access, and we're always happy to answer any questions that folks have or just work through any kind of sticky issues that come up.
I don't see any questions in the chat or online, but I wanted to thank everyone for joining us today. We can stay on if you'd like to reach out to us.
See a question in the chat. Are there any resources for those who have been impacted by the criminal legal system? Are you referencing specifically like access to gender affirming care, or just like in general? Both.
There is a program at Disability Rights California that's specifically a project that's working on this. Let me find the contact information for the individual.
There's also TGIJP. They also would be a good resource. I can put their website in the chat as well. Here, let me, I'm going to stop sharing and if I can put that in the chat. But that's another resource that I would recommend. Is TGIJP. Let me pull that up.
I see another question. Are there specific resources for teens? I almost always refer individuals to Trans Family Support Services. They're based here in San Diego, but they do a lot of great work. And Kathy Molik, who's the CEO, I've worked with really closely on quite a few cases, and she refers cases to us. So I would definitely recommend that as a resource, and I'm sure others have more. Wonderful. We have someone from Trans Family Support Services. So yes, they can also speak to how highly I think of them and what a great resource they are for the community. I know that they do a lot of groups and different activities, and for both teens and parents and friends and stuff like that. So definitely check them out.
There's also Gender Spectrum. They also, I think, in July, they had their conference. They had like an international conference. And I'll put their website here as well. They're another resource for you. Any other questions or comments? We have a few minutes left.
All right, if we don't have any other questions, thank you so much to everyone for joining us today, whether this was your first session of the day or if you were with us since bright and early for the Rainbow Connection. We really thank you for taking the time to spend part of your day with us. If you haven't had a chance to complete our Out for Mental Health Priorities survey yet, we would really love your input on completing that, as well as our evaluation for the day. And both of those links are available in the app. I'll also drop them in the chat here. This is the end of our programming for the day. Thanks again so much for being here. Thanks for all of you. Anyone who signed up to go in person, thank you for your flexibility. We are bummed to not have gotten to spend the time together with you all in Los Angeles, and hopefully the world will be safe enough that we can gather soon. And thanks to our amazing presenters and interpreters for all of your time today as well. Really appreciate you sharing your expertise with all of us.
Thank you for having us.
Oh, Beck, did you say there's another question? Sorry.
No.
Oh, go ahead.
Apologies. Everyone should be heading back to the main session after a 10-minute break. The main session will start out again at 2:30.
Yep, so let me actually put that in the chat here.
Wonderful. Thank you all. Have a great afternoon.